My name is Michelle Trosit, and I'm the immediate past president of the National Academies of Practice. And I am thrilled today to be here with you with Christian Patrick from EBSCO, one of our sponsors. And Christian, thank you so much, and thank you to EBSCO for being here today with us.
Oh, it's our pleasure. We're happy to be here.
Yes. So can you tell us a little bit about EBSCO as an organization, what your purpose is? We'd love to hear.
Yeah, so EBSCO Information Services is an evidence-based provider of journals, ebooks, practice resources for the entire interdisciplinary care team. So we provide resources to doctors, nurses, and everyone along the continuum to help them keep up with the latest research. Maybe they're doing a poster or presenting at a conference, or maybe they're doing bedside clinical interventions that they want to know what the latest evidence is. So we provide a gamut of evidence-based information resources for the whole healthcare continuum.
Wonderful. And then how does, what is the role of EBSCO with interprofessional education? Anything specific for education, Christian?
Yeah, there's a lot of exciting initiatives that we're working on. I would say we were early bought into this idea of the interdisciplinary care team in an interdisciplinary professional practice. We have an editorial team that builds our evidence-based content. And from the start, we saw evidence-based content as being relative and important for the whole care team. So we have products for physicians, for nurses, social workers, the therapists, and they all come from the same evidence-based core. And in that, so if there is a practice-changing update, if there's a black box warning on a drug, the evidence cascades down through all of our various resources. And in this way, the whole team has the same information, right? They're gathering the same information, and they understand the same evidence basis for things. A couple of years ago, the guidelines around prophylaxis for DVT changed. Well, we changed topics across the board. That's not just a physician problem or a nurse problem, right? The whole care team needs to know what the new guidelines are. And so that's the kind of way that we can interact with the entire care team, and not just, sometimes we see in the evidence-based world, we talk about evidence-based medicine, implying that only doctors need to know when things change. But as you know, Michelle, that's not true. The whole care team needs to understand, because they're part of that care. They're part of giving that care to the patient. So they need to know what the latest evidence, what the best guidelines are for a particular disease topic.
Yeah, that's such a great point, because it doesn't help if just one profession or one discipline has that information. It really needs to be shared across all of them. And I know that EBSCO really excels at that, with just bringing that professional role of the nurse, the dietitian, the social worker, the physician, but the evidence that informs the whole team comes from that single source of content that you all have. That's really wonderful. Yeah.
Thank you.
What are you doing for tools that you mentioned, products and tools? What are you doing for really shared decision making? Are you doing anything specific in that space?
Yeah, we are, in fact, because we see one of the pillars of evidence-based practice is that patient preference, right? And so we have moved and added shared decision-making tools, specifically patient decision aids, as a component that's offered to the care team. And again, as you say, we're not just offering that up to our physicians or our physician products, but we're delivering that in a way that the whole care team can see that through the electronic health record. We can embed those tools into the patient health record, because it's interesting. Shared decision-making emphasizes this, but EBSCO also thinks about the patient as being in the center of that care team, right?
Right.
So we also have evidence-based resources for patient education, but also shared decision-making tools that can give risk assessments, and I don't want to say simplify, but interpret the stats in a way that are consumable for a patient population. So that's a great example of a way where we're building tools that are based on the evidence, that they're useful for the interdisciplinary care team, but are also relevant to the patient in their owning their own care.
Yeah, that's wonderful. That is so important these days to have patients and families really involved in their care. And so really appreciate bringing those new tools so that everyone doesn't have to reinvent the wheel, right, on how to do it as well.
Yeah.
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 So if
you're asking about.
Go ahead.
You were asking about educational opportunities. And one of the things that we're really excited about innovating in is continuing education in an earn as you learn kind of format. This is a great example where in the past, maybe there was haves and have-nots in terms of continuing education, where physicians could do real-time, inline, self-directed learning, and yet a lot of other disciplines needed to keep track of their hours and do these really specific modules. And so a way that EBSCO is breaking that barrier, if you will, is innovating where you can use other professionals, nurses and therapists can use our tools at the point of care or doing research, and our systems can keep track of the interactions that they're doing, both based on searches, but based on time, and then can fill out a form at the end saying, this changed my practice, I learned something new, to fulfill those requirements for continuing education on a continuous basis, not on a credit hour basis.
Well, that's very innovative. Something I'm sure is very welcome to practitioners everywhere, so that, you're learning as you're caring and learning,
Yeah.
So that's awesome. Great. Where can people go to learn more about EBSCO from our National Academies of Practice?
Yeah, so you can go to the NAP website where we have links through to our website, or you can go to ebsco.com, which is EBSCO.com, where we have the whole complement of resources available to you. Typically our licensing model is through your institution. So the healthcare system that you're working with or working for often will get an institutional license that allows you and your colleagues to use as much as you want, meaning you can use it at home. If you're pursuing a professional degree or an advanced degree, you can use EBSCO resources for that as well. So one of the things that's nice is that, especially if your institution is licensing EBSCO resources, you can use them for all the facets of your busy professional life.
Great. Thanks, Christian, so much. And the National Academies of Practice really appreciates EBSCO's support, and we appreciate your time today. And we will encourage people to stay connected with EBSCO. Thank you very much.
Thank you very much, Michelle.